Question 1. A patient with uncontrolled type 1 diabetes presents with deep, rapid respirations and fruity-smelling breath. What is the nurse's priority intervention? A. Administer IV regular insulin. B. Give subcutaneous insulin glargine. C. Offer oral fluids with electrolytes. D. Prepare for emergency intubation. Answer. A. Administer IV regular insulin. Rationale. Kussmaul respirations and fruity breath indicate diabetic ketoacidosis, DKA, requiring IV insulin to correct hyperglycemia. Subcutaneous insulin is too slow. B. Oral fluids are contraindicated due to altered consciousness. C. Intubation. D. May be necessary, but only after insulin and fluids. Question 2. A nurse suspects Addisonian crisis in a patient with hypotension, confusion, and hyperkalemia. What is the immediate nursing action? A. Administer IV hydrocortisone. B. Start an IV dextrose infusion. C. Restrict fluid intake. D. Administer subcutaneous insulin. Answer. A. Administer IV hydrocortisone. Rationale. Addisonian crisis is life-threatening adrenal insufficiency needing IV corticosteroids immediately. Dextrose. B. May follow, but hormone replacement is the priority. Question 3. A patient with Cushing syndrome is at highest risk for which complication? A. Infection. B. Hypotension. C. Weight loss. D. Hyperkalemia. Answer. A. Infection. Rationale. Elevated cortisol suppresses immune response, increasing infection risk. Hypertension and hypokalemia are more likely than hypotension or hyperkalemia. Question 4. A patient receiving desmopressin, DAP, for diabetes insipidus suddenly develops confusion and headache. What should the nurse do first? A. Check serum sodium levels. B. Withhold the next dose. C. Notify the healthcare provider. D. Give additional desmopressin. Answer. A. Check serum sodium levels. Rationale. Symptoms suggest water intoxication and hyponatremia. Confirming sodium levels is crucial before further intervention. Question 5. During thyroid surgery, the patient develops stridor and difficulty breathing. What should the nurse do immediately? A. Prepare for tracheostomy. B. Reposition the patient supine. C. Give IV calcium gluconate. D. Assess oxygen saturation. Answer. A. Prepare for tracheostomy. Rationale. Stridor indicates airway obstruction from laryngeal edema or hematoma. Prepare airway support immediately. Question 6. A patient with SIAD is receiving fluid restriction. Which finding indicates effective treatment? A. Increased urine output. B. Weight gain. C. Confusion. D. Hypertension. Answer. A. Increased urine output. Rationale. SIAD causes water retention. Increased urine output shows improved water balance. Weight gain and confusion indicate worsening condition. Question 7. A nurse is caring for a patient with hypoparathyroidism. Which lab value requires immediate action? A. Serum calcium 6.5 milligrams per deciliter. B. Serum phosphate 4.0 milligrams per deciliter. C. Sodium 137 milliequivalent per liter. D. Magnesium 1.8 milligrams per deciliter. Answer. A. Serum calcium 6.5 milligrams per deciliter. Rationale. Severe hypocalcemia can cause tetany and cardiac arrest. It requires prompt IV calcium administration. Question 8. A patient with diabetic ketoacidosis is receiving IV insulin and fluids. Which assessment finding indicates treatment effectiveness? A. Decreasing serum ketones. B. Persistent polyuria. C. Decreasing serum potassium. D. Increasing glucose levels. Answer. A. Decreasing serum ketones. Rationale. Reduction of ketones indicates metabolic correction. Glucose and potassium may fluctuate, but are secondary markers. Question 9. A nurse identifies Trousseau's sign in a post-thyroidectomy patient. What should the nurse anticipate administering? A. IV calcium gluconate. B. Oral potassium chloride. C. IV magnesium sulfate. D. IV dextrose 10%. Answer. A. IV calcium gluconate. Rationale. Trousseau's sign indicates hypocalcemia due to parathyroid injury. Calcium replacement prevents tetany. Question 10. A patient with pheochromocytoma reports severe headache and palpitations. What is the priority intervention? A. Administer antihypertensive medication. B. Encourage deep breathing. C. Check blood glucose. D. Prepare for surgery. Answer. A. Administer antihypertensive medication. Rationale. Hypertensive crisis from catecholamine surge is life-threatening. Blood pressure control is priority. Question 11. Which assessment finding indicates effective treatment in a patient with hyperthyroidism receiving methimazole? A. Decreased heart rate. B. Weight loss. C. Tremors. D. Heat intolerance. Answer. A. Decreased heart rate. Rationale. Methimazole suppresses thyroid hormone synthesis. Lower HR shows improvement. Weight loss and tremors indicate uncontrolled disease. Question 12. Which patient should the nurse assess first? A. A diabetic patient with glucose 420 milligrams per deciliter and dry mucous membranes. B. A hypothyroid patient with fatigue and constipation. C. A Cushing's patient with weight gain. D. An Addison's patient on prednisone. Answer. A. A diabetic patient with glucose 420 milligrams per deciliter and dry mucous membranes. Rationale. Severe hyperglycemia indicates dehydration and possible DKA, which is a medical emergency. Question 13. A nurse prepares to administer insulin lispro. When should this medication be given? A. Within 15 minutes of a meal. B. 1 hour after eating. C. At bedtime. D. With NPH insulin only. Answer. A. Within 15 minutes of a meal. Rationale. Lispro is rapid-acting insulin. Giving it near mealtime prevents hypoglycemia. Question 14. A patient with hypothyroidism complains of fatigue despite medication. Which action should the nurse take first? A. Assess adherence to levothyroxine. B. Increase the medication dose. C. Recommend rest periods. D. Encourage weight loss. Answer. A. Assess adherence to levothyroxine. Rationale. Non-adherence is the most common cause of persistent hypothyroid symptoms. Dose changes require provider input. Question 15. A nurse notes that a patient with hyperparathyroidism has a serum calcium of 11.2 milligrams per deciliter. What is the priority intervention? A. Encourage oral hydration. B. Restrict sodium intake. C. Increase calcium-rich foods. D. Administer vitamin D. Answer. A. Encourage oral hydration. Rationale. Adequate hydration helps excrete excess calcium and prevent kidney stones. Question 16. A nurse caring for a patient with DKA notes potassium 3.0 milliequivalent per liter before insulin therapy. What should the nurse do? A. Hold insulin and notify provider. B. Administer insulin as prescribed. C. Start sodium bicarbonate IVD. Restrict potassium intake. Answer. A. Hold insulin and notify provider. Rationale. Insulin lowers serum potassium further. Replacement must occur before administration. Question 17. A nurse evaluates teaching for a patient on levothyroxine. Which statement indicates understanding? A. I will take this medication on an empty stomach each morning. B. I'll take it with my iron supplement. C. I can stop taking it once I feel better. D. I'll take it before bedtime. Answer: A. I will take this medication on an empty stomach each morning. Rationale: levothyroxine absorption decreases with food or supplements. Morning administration on empty stomach is ideal. Question 18. A nurse suspects myxedema coma in an unresponsive patient with hypothyroidism. What is the first nursing action? A. Maintain airway and provide ventilation. B. Administer IV glucose. C. Give oral levothyroxine. D. Start external warming. Answer: A. Maintain airway and provide ventilation. Rationale: myxedema coma causes respiratory depression. Airway management is the first priority. Question 19. A patient with Cushing's syndrome has new bruising and muscle weakness. Which nursing intervention is most appropriate? A. Implement fall precautions. B. Restrict sodium intake. C. Encourage ambulation. D. Provide a high-protein diet. Answer: A. Implement fall precautions. Rationale: muscle weakness and skin fragility increase fall risk. Safety is the top priority. Question 20. A diabetic patient scheduled for surgery has a morning glucose of 60 milligrams per deciliter. What should the nurse do first? A. Hold insulin and give juice. B. Administer insulin as ordered. C. Proceed with surgery. D. Document and continue monitoring. Answer: A. Hold insulin and give juice. Rationale: hypoglycemia requires immediate correction with carbohydrates before surgery or insulin administration. Question 21. A patient with type 1 diabetes presents with rapid breathing, nausea, and confusion. What is the nurse's first action? A. Check serum ketones. B. Administer IV fluids. C. Provide oxygen. D. Give subcutaneous insulin. Answer: B. Administer IV fluids. Rationale: DKA management begins with restoring circulation and perfusion through IV fluids before insulin therapy. Question 22. A patient on long-term prednisone reports sudden weakness and low BP after abruptly stopping the drug. What should the nurse suspect? A. Acute adrenal insufficiency. B. Cushing syndrome. C. Hypothyroidism. D. SIAD. Answer: A. Acute adrenal insufficiency. Rationale: sudden steroid withdrawal suppresses adrenal function, causing hypotension and fatigue. Question 23. A nurse caring for a patient with diabetes insipidus notes serum sodium 156 milliequivalent per liter. What intervention is the highest priority? A. Administer desmopressin. B. Provide salt restriction. C. Start IV dextrose 5% in water. D. Encourage oral fluids. Answer: A. Administer desmopressin. Rationale: DI causes fluid loss and hypernatremia. Desmopressin replaces ADH to restore water balance. Question 24. A patient with Cushing's disease develops a new infection. What is the nurse's best action? A. Report the finding immediately. B. Increase fluid intake. C. Continue routine observation. D. Reduce corticosteroid dose. Answer: A. Report the finding immediately. Rationale: immunosuppression from excess cortisol increases infection risk. Early reporting prevents sepsis. Question 25. A nurse assesses a patient with hypothyroidism who reports feeling unusually cold and drowsy. Which intervention takes priority? A. Assess respiratory status. B. Offer warm blankets. C. Increase thyroid medication. D. Provide hot fluids. Answer: A. Assess respiratory status. Rationale: myxedema can cause respiratory depression. Airway and breathing take priority. Question 26. A patient with Addison's disease presents with vomiting, hypotension, and confusion. What is the first nursing action? A. Administer IV hydrocortisone. B. Give oral prednisone. C. Encourage salt intake. D. Start oral fluids. Answer: A. Administer IV hydrocortisone. Rationale: Addisonian crisis requires immediate corticosteroid replacement to prevent shock. Question 27. A nurse notes a patient with diabetes has a glucose level of 520 milligrams per deciliter and pH 7.12. Which order should be implemented first? A. Infuse normal saline. B. Administer IV regular insulin. C. Give potassium chloride. D. Obtain urine for ketones. Answer: A. Infuse normal saline. Rationale: Initial management of DKA focuses on correcting dehydration before insulin therapy. Question 28. A nurse is monitoring a patient after thyroidectomy who suddenly complains of difficulty breathing. What is the first action? A. Prepare for emergency tracheostomy. B. Elevate the head of the bed. C. Apply oxygen. D. Assess incision site for bleeding. Answer: B. Elevate the head of the bed. Rationale: Elevating the head reduces neck swelling and promotes airway patency. Airway management follows as needed. Question 29. The nurse notes a patient with SIAD has serum sodium 118 milliequivalent per liter and complains of headache. What is the priority action? A. Implement seizure precautions. B. Restrict fluids to 800 milliliters per day. C. Administer furosemide. D. Encourage oral salt intake. Answer: A. Implement seizure precautions. Rationale: Severe hyponatremia can cause seizures. Safety is the top priority before fluid correction. Question 30. A patient with diabetic neuropathy reports unsteady gait and frequent falls. What should the nurse do first? A. Assess home safety and refer to physical therapy. B. Increase fluid intake. C. Encourage daily jogging. D. Reduce insulin dosage. Answer: A. Assess home safety and refer to physical therapy. Rationale: Neuropathy affects balance. Fall prevention and physical therapy are crucial for safety. Question 31. A patient on high-dose corticosteroids reports black tarry stools. What should the nurse do first? A. Notify the healthcare provider. B. Provide an antacid. C. Reassure the patient. D. Offer oral hydration. Answer: A. Notify the healthcare provider. Rationale: Black stools suggest GI bleeding due to steroid-induced ulcers. Immediate evaluation is needed. Question 32. A patient with hyperthyroidism develops confusion, sweating, and tremors. What complication does this indicate? A. Thyroid storm. B. Addisonian crisis. C. Hypoglycemia. D. Myxedema coma. Answer: A. Thyroid storm. Rationale: Exaggerated hyperthyroid symptoms indicate thyroid storm, an endocrine emergency requiring beta blockers and antithyroid medication. Question 33. A diabetic patient with a foot ulcer reports tingling and loss of sensation. What is the priority nursing action? A. Inspect the wound and document findings. B. Notify the wound care specialist. C. Clean the wound with antiseptic. D. Teach foot care and protective measures. Answer: A. Inspect the wound and document findings. Rationale: Assessment is always the first step to determine extent and guide care. Question 34. A nurse suspects hypoglycemia in a conscious diabetic patient. What should the nurse do first? A. Give 15 g of fast-acting carbohydrates. B. Check blood glucose. C. Call for emergency assistance. D. Start IV fluids. Answer: B. Check blood glucose. Rationale: Confirm hypoglycemia before intervention. Treatment follows based on readings. Question 35. A patient with acromegaly reports joint pain and enlarged hands. Which diagnostic test confirms the condition? A. Elevated growth hormone levels. B. Low ACTH levels. C. Low TSH levels. D. Elevated cortisol levels. Answer. A. Elevated growth hormone levels. Rationale. Excess GH from pituitary adenoma causes acromegaly. Lab confirmation is key. Question 36. A diabetic patient scheduled for surgery has morning glucose of 65 milligrams per deciliter. What should the nurse do first? A. Give orange juice. B. Hold insulin and notify provider. C. Proceed with surgery. D. Administer glucose IV. Answer. A. Give orange juice. Rationale. Mild hypoglycemia is treated orally if the patient is conscious. IV glucose is for severe cases. Question 37. A patient on desmopressin develops sudden weight gain and confusion. What should the nurse suspect? A. Water intoxication. B. Dehydration. C. Hypoglycemia. D. DKA. Answer. A. Water intoxication. Rationale. Desmopressin can cause fluid retention and hyponatremia, leading to confusion and weight gain. Question 38. A nurse is caring for a patient with DKA. Which lab result indicates therapy is effective? A. Blood pH increases to 7.35. B. Glucose remains 350 milligrams per deciliter. C. Potassium rises to 6.0 milliequivalent per liter. D. Ketones persist in urine. Answer. A. Blood pH increases to 7.35. Rationale. Correcting acidosis confirms improvement. Persistent hyperglycemia and ketones indicate ongoing DKA. Question 39. A patient with hypothyroidism is taking levothyroxine. Which finding requires immediate follow-up? A. Heart rate 110 BPM. B. Weight loss. C. Increased energy. D. Normal temperature. Answer. A. Heart rate 110 BPM. Rationale. Tachycardia indicates possible overdose or excessive hormone replacement. Question 40. A diabetic patient receiving insulin infusion shows potassium 2.8 milliequivalent per liter. What is the nurse's best action? A. Stop insulin and notify provider. B. Continue insulin and monitor glucose. C. Administer furosemide. D. Restrict oral intake. Answer. A. Stop insulin and notify provider. Rationale. Insulin drives potassium into cells, worsening hypokalemia. Replacement is needed before continuation.